Good evening, everyone. Welcome to our Instagram live from Limi Hospital. Here with me is Dr. Amos Attah, a consultant obstetric and gynecologist, and I'm Dr. Achimalo Ifunanya, your personal physician. So today we're going to be talking about the antenatal health talk. So, Dr. Attah, what can you tell us about antenatal health care?
Okay, well, welcome to this edition of Instagram Live. By way of introduction, antenatal care is a careful, systematic assessment and follow-up of pregnant women, which entails counseling, education, and screening and treatment of pregnant women to ensure that all those ailments that are being identified during the course of screening are treated properly to ensure a positive pregnancy experience at the end of the day for these pregnant women. Antenatal care actually started several centuries ago in France, and it was mainly for indigent patients. But however, it has undergone many modifications to the present model, which is being practiced all over the world presently.
Okay.
And mainly, the whole essence of antenatal care is to screen women when they come for basic ailments and institute appropriate intervention for these very women to ensure a very positive outcome, to ensure that at the end of the day, a live baby is being delivered to a healthy mother.
Okay. So during these antenatal visits, what do women usually screen for?
Actually, there are a lot of ailments that women are being screened for. But before then, I want to just buttress the essence of this very Instagram live. The essence is to educate our pregnant women for them to be enlightened because it's good for them. They say knowledge is power. And when they are enlightened, it helps them to be part of the management of their pregnancy. A lot of studies have been carried out all over the world, and it has been shown that educated pregnant women end up having a good outcome at the end of the day compared to those ones that are not educated. And that portrays the importance of this very edition of our Instagram Live. We are here to educate our pregnant women for them to be more educated and empowered with regards to their pregnancy.
Mm, that's all right. Then in the screening, I know that usually when they come for the visits, they usually have their HIV screening, their blood group checked,
Yes.
their urine test done, their fasting blood sugar done, and different tests that they do, even tests for syphilis and all whatnot.
Yes. Actually, there are a lot of tests to be done, but usually, if for a pregnant woman, we focus on those tests that are very beneficial to them. For example, we start when a pregnant woman comes for booking, we want to take the height of this woman.
Yes.
What is the height of this woman? There's what we call the critical obstetric height, which is 1.51 meters. Those ones less than 1.5 meters, they are prone to some morbidities or adverse outcome. Not all of them, but it raises the index of suspicion so that you, as a caregiver, you'll be more aware and put in necessary measures to follow them properly and ensure a positive outcome for them. They are prone to contracted pelvis, and as such, the importance of taking their eye. Secondly, you want to check their blood pressure at booking. For those that have elevated blood pressure, some may be chronically hypertensive but never aware that they have elevated blood pressure. At booking, if you're able to pick them, you'll be able to start them on antihypertensive to ensure that this blood pressure becomes well controlled during the course of pregnancy and ensure that it does not have adverse outcome on the baby or on the mother. Likewise, when they present, we want to do HB, which means hemoglobin test. Hemoglobin is the substance in the blood that conveys oxygen to the tissues and at the end of the day to the baby. And, and as such, if the hemoglobin is low, you want to institute measures to start building up the hemoglobin level so that they will have enough hemoglobin to be able to transport oxygen and nutrient to the baby as well. You want to check group, their blood group to know whether, especially the rhesus group, whether they are positive or negative. In the general population, 85% of people are rhesus positive. However, in 15% of people, they are rhesus negative. For those rhesus negative, you need to follow them up, especially if they are not pregnant for the first time. If it's for the first time, usually it goes uneventful. But for subsequent pregnancies, you want to ensure that you be able to institute appropriate measure in order not to affect baby. You want to know their HIV status, their hepatitis B status, and syphilis. These are sexually transmitted diseases. And also, apart from that, they can be transmitted to the baby via the placenta. And as such, you want to institute measures for those ones that are positive to ensure that the baby, the in utero baby, does not become infected with any of these diseases. You also want to do a urinalysis. From this simple test urinalysis, you can get a lot of information. You can be able to identify those ones that has diabetes. You want to identify those ones that has urinary tract infection. You can identify, yes, those ones. And as such, you do your urine test. And also, you want to do an obstetric scan. Obstetric scan will help you to identify the position of this baby. Some people are pregnant. In few instances, it can be an ectopic pregnancy. The essence of the scan at booking is to identify the position of this pregnancy. What is the viability? Is the baby viable? Also, you want to know. It will help you also to what? To date the pregnancy. Early pregnancy is very important in dating. Studies have shown that even in educated women in the society, about 65% are not sure of their last menstrual period.
Yes.
And as such,
Very
early pregnancy, early ultrasound scan is very good and very accurate in dating the pregnancy. Apart from this general investigation, there are other investigations based on either their past history, their family history. There are some that will have family history of diabetes. You want to go ahead, you do oral glucose tolerance test to be able to identify them if they have gestational diabetes and institute measures for a better outcome at the end of the day.
It's really nice that we're now aware of this thing. So, for the pregnant women, the first time mothers that are not so sure about what to do when they're about to deliver, they need to know how to get prepared for the birth of the baby. So, what are these women supposed to know? What can you tell the mothers out there about planning for the birth of their child?
Actually, thank you for this question. This question is very paramount and very important. Actually, when a woman becomes pregnant, the preparedness for delivery starts from the very point in time that she is aware that she's pregnant. A lot of